Hi, I'm Dr. Prashanth. I'm Psychiatrist and Sexual Wellness Expert. I'm co-founder and director at PassionFruit Wellness, Bengaluru and Pune.
I get a lot of questions on the early discharge or premature ejaculation in men. Now, the premature ejaculation is the most common problem in men or most common sexual dysfunction in men, where a lot of men are there suffering, but very less people that talk about it. So let's try to understand about it. The premature ejaculation means someone is discharging very quickly. It is just layman's language definition I am telling. Someone is discharging very quickly or against his or her wish. So which obviously led to less confidence, less self-esteem, and it may impact the relationship with the partner. Now, what are the factors which causes premature ejaculation? So let's talk about the psychological factors, biological factors, and the behavioral factors. So let's talk about the first main reason for premature ejaculation is psychological factors. So we all know that the anxiety, someone is going through depression, someone is going through different anxiety disorders like OCD, any guilt feeling secondary to many issues can lead to premature ejaculation. Now, if we talk about the biological factors, yes, we all know that there are lots of hormones in our body which are responsible for premature ejaculation. For example, the thyroid, maybe hypothyroidism and hyperthyroidism both can cause the premature ejaculation. Even the prostate infection, which is called as prostatitis, also can cause premature ejaculation. A lot of men, they are having very sensitive glands, or in layman's language, the sensitive head. So even if you touch the head of the penis, so the men usually discharges semen very quickly. So which is very common complaint, means they can have foreplay for long duration, like 15 minutes, 20 minutes, sometimes half an hour, they can maintain their erection. However, once they touch the vaginal part, they discharge quickly before penetration or immediately after penetration, because the glans is very sensitive, because the head of the penis is very sensitive part of the genital and which is supplied by lots of neurons, which increases the sensitivity. So this is one of the biological factor for premature ejaculation. If we talk about the behavioral factors, which is very interesting part, a lot of men, they come to me and they talk about the masturbation habit. Again, we will cover masturbation topic during other discussion, but basically the people, they come and they tell, doctor, I'm having premature ejaculation. Is it because I have done masturbation excessively during my childhood or during my adolescent age? So answer may not be yes or no here, but if we talk about their behavior, because when you are in adolescent age or you are becoming adult, so you are living with family and or you are always in a hurry, or you want to finish it fast, or you are in washroom and you may feel that if someone is waiting outside, so you want to finish it fast. So once you develop that habit, so obviously that message goes to your brain, and brain thinks that this is what normal is. So you start stroking your genital, the brain feel, oh, this is what I need to give signals fast, and you discharge quickly. So that habit is developed, and whenever someone is having excessive masturbation, so this habit or this message is registered in the brain. So that may impact in your sexual health when you are into relationship with a partner or you are married. So whenever you are having sex with a partner, the brain thinks that whatever registered during your childhood or adolescent age, and that is what the normal is, and you quickly discharge. This comes under the behavioral factor. So as I said, the premature ejaculation is a very common problem. So many men, they are going through this problem and this phase. The question comes that when one should seek the treatment or when one should visit the doctor. The answer is very simple. If someone is discharging semen or ejaculating semen every time or most of the time whenever they are having sex, there are two types of premature ejaculation, that is lifelong and acquired. Lifelong means someone is ejaculating quickly from very first sexual experience, and acquired means someone had a very good sex life in the past. However, for whatever reason, the person started suddenly ejaculating quickly during the intercourse. So that is acquired premature ejaculation. So one should seek help when the person is discharging or ejaculating every time, and premature ejaculation that is leading to the stress, the anxiety, and the relationship issues with the partner. So definitely one should think of visiting doctor and get treated or get consultation for this. I also seen that many clients, so once they start experiencing this problem, that is premature ejaculation, they lose their confidence. The couple is having very emotional intimacy, they are well connected emotionally. However, once the person is started having this problem, they lose the confidence, and not to disappoint partner, they start avoiding. So they come home, they are doing every other chore, every other activity. However, when it comes to bed, so they start avoiding the physical intimacy with partner. So when you experience this, then definitely you should seek treatment or you should seek the consultation from the doctor. I was talking about the acquired premature ejaculation, means someone had a good sex life in the past and suddenly the person started having this premature ejaculation experience. So this premature ejaculation experience, I was talking about the biological factors. So you may have the thyroid issues or prostate infection. So sitting at home, you can't avoid, means premature ejaculation could be the symptom of thyroid, could be symptom of prostate infection. So just don't take it lightly. So these are the conditions where you should seek treatment from the doctor or consultation from the doctor. You also seek treatment or consultation from doctor when it affects your self-esteem. It affects your relationship with the partner, because if it is happening frequently or almost every time, so obviously how much ever your partner is cooperative, since it is a basic need of life and you are not taking any action on this, it may impact the sexual desire issues or many other sexual health issues with your partner, and that leads to irritation, frustration, disappointment, and that's how it impacts your good relationship with your partner. So definitely in these kind of cases you should consult your doctor. Now if we talk about the treatment aspect, so many people think that premature ejaculation is not treatable. It is not like that. The good news is the premature ejaculation is really treatable. So there are different treatment modalities. Counseling, definitely it is one of the treatment part. Then different relaxation techniques. Obviously you can't learn relaxation techniques on internet. You need to consult with the expert. There are different treatment modalities, different behavioral therapies which the expert can teach you how to control the premature ejaculation. And of course the medicines has a big role controlling premature ejaculation. There are different myths about premature ejaculation, lots of doubts, lots of myth, they are wrong conception in their mind, and that is one of the reasons that they avoid visiting doctors and take treatment. So one of the myths, if we talk about people suffering from premature ejaculation, they feel that I am not masculine enough. There are different myths about premature ejaculation, different wrong concept in their mind. So one of the myths is, because of premature ejaculation, maybe I am not masculine enough, but that is not the truth. If someone is having premature ejaculation, it doesn't mean that the person is really not masculine. So as I said, it is the most common sexual dysfunction in men. So many men, they go through this kind of phase. So it doesn't mean that everyone is not masculine. So please, this is the myth, so don't believe in this. Another myth, many people they think that premature ejaculation is always psychological. Again, that is not true. The truth is, as I said earlier while discussing the reasons or factors for premature ejaculation, so it can be psychological, but at the same time it can be biological also, because there are different hormones which can lead to premature ejaculation. So the premature ejaculation is not always psychological. Another common myth is, initially only I said, many people they think that premature ejaculation is not treatable. So many patients they come to clinic and they say, doctor, is it true that I read on internet that premature ejaculation is really not treatable? But that is wrong. So as I explained, there are a lot of treatment modalities available to treat the premature ejaculation. So don't believe this truth, and as I said, the premature ejaculation is really treatable condition.